Okay, good afternoon. And we have some participants who are still joining us. But while those people join our session, let me do some introductions. My name is Warren Boykin, and I am the Outreach and Program Coordinator for NAMI Northern Illinois. NAMI Northern Illinois has a mission to improve the quality of life of individuals and families living with mental illness through support, education, advocacy, and hope. And uh, our topic today, you can see, is non-suicidal self-injury with Joanna De Leon of Relieve Counseling. And it's my pleasure to welcome all of you to this Leading the Conversation podcast from NAMI Northern Illinois. Um, Before we begin, I'd like to give you a few updates from NAMI Northern Illinois as we wrap up this year. Want to remind everyone that our Gifts of Hope, our annual Gifts of Hope celebration will be December the 10th at 5:30 at the Stepping Stones main office on North Main. Join us as we pack up gift bags for our neighbors that are in residential care, crisis care, or hospitalized while living with a mental health condition during the holidays. And future Leading the Conversation podcasts, we have a reschedule of our podcast that was delayed because of weather. Um, it'll be on cultural sensitivity and generational trauma on December the 12th at noon over Zoom, featuring Dr. Kevin Thomas of Mentality Unchained. And we will wrap up the year December the 19th at noon over Zoom with Understanding Grief with Cody Barillo, LCSW of Four Corners Wellness Center. Also, just a note to make you aware, the NAMI Northern Illinois offices will be closed and our office staff will be unavailable for calls during the week between December 24th and January the 1st for the holidays. So, happy December. Hope that you're staying warm out there. And we thank you again for joining us to learn about this important topic, non suicidal self injury. With us today is Joanna De Leon of Relieve Counseling. Little word of introduction, Joanna is a licensed clinical professional counselor, the co-owner and clinical director at the Relieve. She's always enjoyed meeting new people and learning their stories. Every individual has a journey that is uniquely theirs, and Joanna's passion for understanding the challenges and triumphs of the human spirit is what ultimately led her to pursue a career in therapy. Her goal for Relief Counseling is to bring together a team of dedicated individuals who share her desire to leave a lasting and positive impact on the lives of the people they serve. Joanna has over 15 years of experience in community mental health, working with adults, adolescents, children, and families. She's trained in various treatment modalities and has extensive experience working with individuals who have difficulty regulating emotions, self harming behaviors, and chronic suicidal thoughts. Joanna has significant experience in working with children and families who are involved in the foster care system and has years of experience in crisis intervention. A couple of housekeeping notes. Uh, the Q&A feature is live, and we will be facilitating questions at the end of Joanna's presentation. So, without further ado, I'd like to introduce or welcome Joanna De Leon.
Thank you.
Hi, Joanna.
Hello, everybody, and thank you for spending your lunch hour with us. So today we're going to be talking about non-suicidal self-injury, which I want to acknowledge is a sensitive topic. So if there's any part of the presentation um, that you need to step out of or take a break from, please feel free. So with that, we're going to go ahead and jump in here. Okay. So, what is non-suicidal self-injury, or also called non-suicidal self-harm, NSSI or NSSH for short? Um, NSSI is the deliberate, direct injury of body tissue without conscious suicidal intent. This is the clinical definition, and it helps us to understand that there are three crucial elements. The first is that NSSI behavior is intentional. Next, its intent is to cause direct harm to the individual. But most importantly, this is not a suicidal behavior. So the prevalence of NSSI in our communities is both surprising and concerning. Current research indicates that approximately 17% of young adults have engaged in self-harming behaviors at some point in their lives. So to put that in perspective, in a typical college classroom of 30 students, about 5 people would have experienced NSSI at some point. So among adolescents, the rates are even higher, with 20% of teenagers having reported and engaging in self-harming behaviors. There has been a significant increase in recent years, particularly among teenage girls. Their rates of self-harm have surged by over 60% just since 2015. This has been influenced by the increased popularity of social media and also additional stressors that were brought on by the pandemic. So, what is the difference between suicidal behavior and NSSI? This distinction is important for several reasons. While both of them involve self-directed harm, they serve fundamentally different purposes. So suicidal behavior is the act of self-harm with the intent to end one's life. That behavior is driven by a wish to die or to escape an intolerable situation permanently. NSSI typically functions as a coping mechanism or a method of emotional regulation, not as an attempt to end life. So think of it as using a pressure release valve. While both of these behaviors are responses to internal pressures that an individual may feel, they have very different intentions and therefore different outcomes. So let's talk about some of the common misconceptions with non-suicidal self-injury. NSSI is not a failed suicide attempt. It is not simply attention-seeking behavior. It's not a phase that people can simply grow out of. And it's not limited to any particular demographic. People of all walks of life could experience NSSI. And lastly, NSSI is not always visible, and it's not always easily detectable like we might think. So understanding these distinctions and these misconceptions help us to approach the topic with clarity and empathy for the people that we work with. It also guides us in providing appropriate support and intervention strategies. So there are several manifestations of self-harming behaviors. These are a few, and we may have encountered individuals who've experienced one or more of these in our line of work. So each of these methods can vary in severity and in frequency. For example, cutting might range from superficial scratches to deeper incisions. Hitting might involve anything from light tapping to severe impact. So some of the more severe forms of self-harm might even require medical attention to treat. So this next group of behaviors might seem like they're less severe, but they can be equally concerning. So some of these behaviors can often fly under the radar because they appear similar to common nervous habits. However, the intensity and the amount of damage that they can cause is what distinguishes them as self-harm. There are several key risk factors that contribute to NSSI behavior, and understanding them is what can help us identify individuals who might need additional support. Mental health conditions can play a significant role. So depression can often is often accompanied by feelings of worthlessness and self-punishment. Anxiety can lead to NSSI behaviors as a way to manage overwhelming worry. Eating disorders frequently occur with self-harming behaviors. Individuals who experience PTSD may use NSSI to manage their flashbacks or to cope with emotional numbness. So they use NSSI as a way to feel something. Also, self-harming is often included as a symptom, of borderline personality disorder. So some other risk factors are people who experience emotional regulation difficulties. So that can look like an individual who has the inability to identify or label their emotions accurately. It might look like somebody who has difficulty managing intense emotional states. And when they experience those states, they end up in a fight, flight, or freeze response. It might look like someone who has limited access to healthy coping mechanisms. It might look like someone who has poor impulse control. Or this might be a person who is overwhelmed by emotional sensitivity. There are also age considerations that are important. The peak onset of non-suicidal self-injury occurs between 12 to 14 years old. And the highest risk period extends throughout adolescence. College or life transitions can often trigger new or an increase in already existing behavior. And research has shown that early intervention has better outcomes. So there are also environmental factors that play a crucial role. Individuals who have a family history of mental health issues, they may have seen NSSI and have learned it as a coping mechanism. Individuals who have exposure to trauma or abuse may engage in NSSI. Peer influence can play a factor in whether or not an individual will engage in self-harm. Academic or performance pressure is another environmental factor. And lastly, limited access to mental health resources can increase a person's risk of engaging in this type of behavior. So now let's talk about the psychology behind all of this. So research has shown consistently that there is a strong correlation between self-harming behaviors and a lower emotional intelligence in a person. So emotional intelligence can be defined by several key components. The first of which is emotional awareness. So someone who struggles in this area can look like a person who has difficulty identifying specific emotions beyond just good and bad. They might be someone who confuses physical and emotional sensations and have trouble distinguishing between one or the other. They might have a limited emotional vocabulary, so they have trouble expressing what it is that they're feeling. They have difficulty connecting emotions to the events that triggered those feelings. And they have challenges in recognizing the emotional intensity level that they're feeling. The next component of emotional intelligence is perspective shifting. So people who struggle with this, their challenges can present like somebody who is unable to see a situation from multiple points of view. They get stuck in black and white thinking patterns. They have difficulty imagining future consequences. So they get stuck in what's happening right now and they can't see beyond this moment. They have limited ability to generate alternative solutions, and they struggle with emotional problem solving. The third component of emotional intelligence is positive reframing. This is an important skill that's often impaired in people who engage in NSSI. So they struggle to find alternative meanings in difficult situations. They have difficulty extracting learning opportunities from the challenges that they face. That means when that same trigger comes up again, they don't have the capacity to respond in a different way. They have the limited ability to reframe their negative experiences. They tend to maintain that negative interpretation, which also means they become resistant to an optimistic perspective that someone else might be offering them. So there are also cognitive patterns that are associated with NSSI, including rumination. And so this thought pattern typically includes things like repetitive thoughts about your perceived failures, continuously replaying negative interactions, obsessive focus on physical appearance. It might be a persistent self-critical internal dialogue and an inability to disengage from those negative thoughts. Another cognitive pattern that we see frequently in NSSI is catastrophizing. So that can look like assuming worst case scenarios, overestimating negative consequences, underestimating your own ability to cope with things that happen, magnifying minor setbacks, and anticipating disaster in routine situations. Now you might be thinking, some of this happens to me sometimes, right? But it's important to recognize that in individuals who engage in NSSI, this is something that happens to them frequently, often multiple times a day. And it happens on a regular basis for them. There's also a neurological component to NSSI. The amygdala, which is our emotional response processing center, often shows hyperactivity in individuals who engage in NSSI. Their prefrontal cortex, which is responsible for regulation, displays a reduced functionality. And this combination creates the perfect storm then for emotional dysregulation. So individuals who engage in self-harm, this physical pain can temporarily restore balance in their neural pathways. However, that relief, even though it's harmful, then just reinforces this behavior. So then what we see is that individuals can then get stuck in the shame cycle. So first, they have that initial stressor, which can lead to those overwhelming feelings. So then that leads to the need for comfort. So they turn to self-harm, which brings on a temporary feeling of comfort, but then is quickly followed by increased shame and guilt. The stressor then of that increased shame then starts the cycle again. So these psychological mechanisms have a significant impact on an individual's coping strategies. First, it can limit their creative problem solving abilities. It reduces their ability to be flexible in their responses to situations. It can increase their emotional vulnerability, which then strengthens their negative self-perception. And all of this maintains that cycle of self-harm for the individual. So these psychological mechanisms that we talked about are additionally impacted by the role of social desirability, or the need for a person to want to fit in with their peers. So then that can lead to masking symptoms to appear normal, maintaining that facade of wellness. It can mean that the individual is avoiding getting help, which can lead to increasing isolation, which then deepens that sense of internal shame for that individual. So, what are some warning signs that someone might be engaging in non-suicidal self-injury? So, there are behavioral indicators that we can look for. That could be unexplained wounds or scars in patterns or clusters, wearing concealing clothing regardless of the weather, frequent accidents or implausible explanations for injuries, could be avoiding situations requiring exposed skin, changes in personal hygiene or grooming habits. It could be carrying around objects that are used for self-harm, or spending unusual amounts of time alone in a bathroom or a bedroom, or collecting things like sharp objects or first aid supplies. So some emotional warnings of self-harming behaviors could be dramatic mood swings, expressions of hopelessness, increased ability or aggression, a sense of sudden emotional numbness or not being able to feel anything, difficulty maintaining relationships, withdrawal or isolation, pulling back from activities that they've enjoyed in the past. It could be feelings of excessive guilt or shame, or intense reactions to what seem to be minor stressors. Lastly, there are physical signs that you could look for. It could be fresh cuts, burns, or bruises that are in various stages of healing, a symmetric or a geometric pattern in wounds. It could be evidence of repeated injury to the same areas. It could be frequent bandage use, or wearing multiple layers or long sleeves in warm weather. There could be signs of picking at healing wounds or unusual placement of injuries. So here are some things that we want to consider when we're assessing an individual who engages in self-harming behaviors. The frequency and the severity of the self-harm episodes. What are the triggers and the precipitating events to these episodes? What are the methods that the individual uses? And is there a pattern of escalation in the methods that they use? What is the impact of their self-harming behavior on their daily functioning? Has the individual, do they have any previous treatment experiences? What are their current support systems like? Do they have one? Also, we want to assess their level of risk in the behaviors that they're engaging in. And lastly, assess, are there any co-occurring mental health conditions going on right now? So what are things that we can do to help support individuals who engage in self-harming behaviors? The most important thing that we can do is create safe environments for the individuals that we encounter. This is the key to effective intervention, and it involves several key elements. The first one is physical safety concerns. So we want to remove access to potential self-harming implements if possible. We want to be able to create designated safe spaces for emotional regulation. We want to establish clear protocols for a crisis situation so that everybody involved knows exactly what to expect. We want to be able to maintain appropriate supervision without hovering over the individual so that we can still allow them to have their autonomy. And we want to structure environments as much as possible to be able to reduce triggers. Secondly, in creating a safe space for individuals, we want to be able to use effective communication techniques. So that includes non-judgmental language. So we want to use I statements with these individuals and not you should or you did this statements. We need to practice active listening, which means maintaining appropriate eye contact, reflecting back content and emotions of what they are expressing to you, avoiding interruptions when they're speaking to you, validating their feelings without endorsing the behaviors. We also want to ask open-ended questions like, how can I support you right now? Or what helps when you feel this way? Or would you tell me more about what's happening? So we want to recognize that the individual is the expert in what's going on with them. We are there as supportive people. We are there in our helping role as a support person to them. But in the end, they are the expert in what's going on with them. So lastly, as part of creating the safe environment, we want to be knowledgeable. We want to be able to provide resources to the individuals that we're working with. So one of those resources would be individual therapy. So things like dialectical behavior therapy or DBT provides both that talk therapy piece and also a skills component that helps individuals with NSSI navigate the things that they're experiencing. There's CBT, there's mindfulness-based stress reduction therapy, there's trauma-focused therapy. We can also encourage individuals to participate in support groups. There are skill-based groups that'll help increase more effective coping strategies in individuals who engage in NSSI. There are peer support groups where they can connect with others who are struggling with similar things. We can encourage their family to join support groups as well, so that they're as much part of the recovery as the individual who's engaging in self-harm. And we can help find recovery-oriented programs for them. We can be aware of what crisis intervention services are available within our area. We have 988 now, which is fantastic. We've got mobile crisis response teams. We can learn what the emergency protocols are for the agencies that we work with. And we can learn about the hospital-based programs that we can refer individuals to. So what are some interventions that you can put in place for the individuals that you're working with? We can help them by developing safety plans and routinely reviewing these with the individual. So that allows them to know when this particular trigger happens, what do I do next? Because in that moment, it's hard to make those decisions. So as much as we can help them cope ahead, it will make the next step more effective for them. We can help them establish support networks. That way they know who their safe people are. If they're triggered, they know who they can go to for help, and they also have backup plans in place. In case that person is unavailable, we have the next one in line ready to go. We can help them identify any triggers and help them share these with their support people as well. And then for us in the helping professions, we can help maintain consistent boundaries so that expectations are established right from the beginning and everyone knows what to expect. We can help individuals by monitoring progress, and a DBT diary card is a great way to do this. It allows individuals not only to track self-harming incidents, but also things like their urges to engage in behaviors, their emotions felt throughout the day. It can help them track coping skills that they've used, among other things. And most importantly, we can celebrate the small victories. We want to celebrate any win that an individual experiences, no matter how big or small. So as we're nearing the end here, let's review some key points that we can take away that'll help us make a difference in supporting individuals who struggle with NSSI. So remember that NSSI is a complex behavior and it requires a compassionate response from us in the helping professional and the helping profession, as well as the support people that surround these individuals. Recovery is possible with appropriate support. And early intervention has shown to have better outcomes. Professional help is essential. And a person's support system plays such a vital role in their recovery. So what can we do? Here are some action steps for everybody. We can learn to recognize the warning signs of self-harming behaviors. We can work developing our own response skills. So whether that looks like role playing with your team or discussing with a more experienced team member what they've done in the past or what they've learned as they've worked with individuals who experience self-harming behaviors. Work on yourself. Know what it is you know, and also what it is you still need to learn. Develop on your own response to people who have self-harming behaviors. Know what resources are available. Figure out what your agency offers. Network with other agencies in the community. Figure out where you can refer people who engage in self-harming behaviors. Maintain a supportive attitude. So all of us in the helping profession, we know that our work is hard. What we do can be physically, emotionally draining. So really check in with yourself. Know what you need to do so that you are recharged if you're feeling close to burnout. How do you maintain that positive attitude for yourself so that you can remain supportive to the individuals that you serve? And lastly, look for continuing education opportunities. The information is out there. Look for it. Expand the knowledge that you have. Talk with other people. Network with other professionals who do what you do. So some things to remember. NSSI affects a significant portion of our population. The behavior serves specific functions, so it is a coping skill. Is it the most effective one? Possibly not. And that's our job, to help people find coping skills that are more effective for them. Remember that recovery is rarely linear, so we need to accept and expect that there's going to be ups and downs in the individuals that we work with. Support must be consistent. And most importantly, hope is fundamental to all healing. Remember that the conversation doesn't end here today. Each of us has the power to make a difference in someone's recovery journey through understanding, compassion, and appropriate support. I want to thank you all for being here today. If there are any questions.
want to draw your
Absolutely.
attention to the Q&A box. Um,
Okay.
Also, um, I want to remind people if you're looking for CEUs, which are sponsored by Rosecrance for social work, counseling, marriage and family therapy, psychologist, or nursing, we will be sending out an evaluation that needs to be filled out and returned to us as soon as possible so that we can get you your CEUs. Um, but I'll repeat that later. Joanna, there is a question in the Q&A. It comes from, I forget, it is from Alejandra, I believe. Anyway, she says, could frequent self-piercing or tattooing be considered non-suicidal self-harm as well, especially for minors or middle schoolers?
That's a common question and is up for debate. And I think it really depends on the intent behind it, right? I think that is a case by case that can be evaluated with each individual, depending on what is the intent behind the piercings or the tattoos. So it's
It seems like um, it varies per the individual then.
a good question.
Also, it seems like it will be really helpful to um, have a good talking relationship. In other words, you've got to communicate to find out what those motivations are, right?
Mhm. Right. And that comes down to, developing rapport with the individuals that we work with.
hmm You mentioned earlier that a safety plan is important and something that is a new development for me personally was I was certified to create RAP plans. Are you familiar with
Mm.
RAP?
Yeah.
The
Hmm.
Wellness Recovery Action Plan technique. And so NAMI has the ability to help individuals create their own RAP plans. And next year, we will be conducting a 2-day class which will teach people how to create their own RAP plans. But if you would like to, or refer people to have assistance creating a RAP plan, we can do that individually or in ones and twos, even right now. And you also mentioned the importance of a support group. Well, NAMI Northern Illinois uh, features uh, support groups for teens as young as 13 years old, going up to, we have a separate support group for adults 18 and older. And there's also support groups for family members of adults or loved ones who are adults. And we also have a another support group for parents of young children. So it's important to have support. And you mentioned the importance of a support network. Here's another question in the Q&A. Can you speak to your experience with foster care and kids who have experienced trauma and how you see non-suicidal self-injury within that population?
Absolutely. So when I worked in foster care, I worked with kids who were in specialized care, which meant that they had higher risk behaviors. Um, and what I found is a lot of the time, these children are growing up and they're not learning the healthy, more effective coping strategies. And so oftentimes NSSI becomes their way to cope. So it really comes down to teaching them that, yes, it is a coping skill, and there are more effective coping skills that we can learn.
Mhm. I also liked when you said that recovery is possible from this and from many other non-helpful behaviors.
Mhm.
There's another question open now. Are there many therapists locally that you are aware of that specialize in treating NSSI?
So there are what I'm a big advocate for DBT. I love DBT. So that might be my bias showing a little bit, but I love that there's a skills training component to it. There are therapists that are trained in DBT. there aren't very many comprehensive DBT programs in our area currently. But I think anyone who's got the background to work on the DBT skills can be very helpful for treating individuals with NSSI.
And it sounds like you're being modest and not um, advertising for yourself. I don't even know if I'm pronouncing your organization's name properly. Can you do that for me?
Sure. Yep. We are Relevé counseling. So it
Relevant. Okay.
speaks a little bit to my dance background.
All right. Because I've been
So
pronouncing it relief counseling, but that's my
that's
American
okay.
bias. I'm sure you hear that all the time, the Midwestern pronunciation. But at any rate, releve. Oh, is that a dance position or something like that?
It is. So the dance position is to rise up on your toes. So our goal is to help people rise above the challenges that they are facing in life.
Well, I won't make that mistake again now that I understand where it comes from. Thank you. Here's another question. So, but before I move on, I want to ask
Mhm,
you, so people can contact you or Releve Counseling for DBT or for um, specializing in non-suicidal self-injury.
mhm.
Is that true?
Absolutely. Yep. We have a team of 4 therapists currently and myself, and we have another therapist joining us in January in the new year. So we're excited about that. So we do have a lot of individuals who contact us with NSSI.
Hmm. And I see your website address
Mhm,
there, www.relevecounseling.com, and your own email address is on the slide here. People can copy. All right, thank you. I think that answers that question. The next question is, I am curious on the overlap with children who have autism or intellectual disability and engage in headbanging type behaviors, or is that a separate category?
So that's a little beyond my purview to answer. I'm not sure how that is. I believe it's a separate category because the intent behind behaviors, the headbanging type of behaviors with those individuals is a different intent and motivation than individuals who engage in NSSI.
Mhm. So you're saying that specifically for autism or people with intellectual disabilities, it's different than what you were talking about. Headbanging can be NSSI in individuals who are not, but you're saying you don't specialize
Mhm.
in autism?
Right.
Okay. Um, that sounds like a good answer for that. Let's see. Okay. The question I
Where are
have
we
here is,
located?
where are you located? Yes.
So we are right in Rockford. We're at the near the intersection of Alpine and State Street.
Which makes it very convenient for us. Um, Hanami, Northern Illinois is right there too. Um, but thank you for that. Next, if there's a other underlying mental illness, what do you treat first, or do you treat concurrently?
So our treatment approach at our agency is the whole person. I think it's hard to separate out one symptom or one mental illness versus another. So we do treat concurrently. We like to say we treat the person where they're at. We don't pick apart this symptom today, right? We want
Hmm.
to treat the whole person, the whole individual.
But of course, your first thing that you mentioned was to create the safety and the safe
Mhm.
environment. So, if the non-suicidal self-injury is creating a safety concern, then of course you have to address that first, correct?
So I think when you develop that therapeutic rapport, people get comfortable being honest about those things. Um, and so if there is a risk assessment that needs to be done, we complete that first. But it really comes down to separating out suicidality versus self harm.
Hmm. Very interesting. And you talked about creating a safe environment. Could you make any recommendations about how a family might be able to create that safe environment, removing harmful potentially harmful objects from their environment.
I think the biggest thing is opening that line of communication so that the individual can be honest about the behaviors that they engage with, trying as much as possible to reduce the shame that surrounds that so that people can feel comfortable talking about it. And then the family can work together to reduce access to things, whether that's sharp objects or whatever the case may be.
Hmm. Let's see. Oh, there's a good question in the chat. Um, is it possible to get copies of your slides?
Oh, absolutely. Do I email them to you, Maureen,
That
or
would
what
be
would be the
fine.
easiest? Okay,
Send it to me as a PDF, and we will find a way to share the slides as well as the recording will be um, on our YouTube page. There's a NAMI Northern Illinois YouTube page you can search for past Leading the Conversation recordings there. And of course, this one will be up within the next couple of days.
and then also, if anyone wants to shoot me an email, I'd be happy to share some resources, like the DBT skills diary card I talked about briefly, or even examples of safety plans. Happy to do that.
I'd love to have a copy of that that we could put along with the copy of the slides. So
Sure,
if you could
sure.
email that to me or to Danielle. Um, Once again, I want to mention if you're looking for CEUs, which are sponsored by Rosecrans for social work, counseling, marriage and family therapy, psychology, uh, psychologists or nursing, we will send out an evaluation that needs to be filled out and returned to us as soon as possible. So we have a list of the attendees, and we will send everyone the evaluation with what you need to get your CEUs. So I think that is all of the questions and comments that we've
Okay.
got open. I want to thank you very much for a very informative presentation, Joanna, and thanks for answering my
No
questions as
problem.
well. Again, my name is Warren Boykin. I'm the Program and Outreach Coordinator for NAMI Northern Illinois. Uh, NAMI Northern Illinois is available on our website, www.naminorthernillinois.org, and we are happy to answer your questions. You can email us at info@naminorthernillinois.org. Uh, we will be having other webinars. Keep your eye on our website for future presentations. And once again, Joanna, thank you so much.
Thank you for having me.
We're getting lots of thank yous from our participants, and thank all of you for giving us giving up your time. Double check and make sure we have no more questions. This looks like just more words of gratitude. So um, I hope that this helps people and that they get in contact with you if they need specific assistance.
Sounds good. I hope you all enjoy the rest of your day.
Yes, and have good holidays too. Um, Thank you very much. We're going to end our session now. Have a great day, everyone.